Dr. Aznavour, when does a person, or a tooth for that much, need a root canal? What are the circumstances? Can a patient like me who doesn't know nothing about dentistry know when he maybe needs a root canal? Does it even matter whether he knows or not? Talk about root canal. Tell us what it is all about, that business of root canal.
A root canal is basically, in terms of dentistry, is the removal of the nerve of the tooth. Now, that nerve is what will translate hot or cold in the tooth. Just because you do a root canal doesn't mean your tooth is gone or the roots are gone. It has nothing to do with that. It has essentially to do with the nerve. Now, when do you need a root canal? There's a few instances where you might need a root canal. The causes of people needing root canal is 1, a large cavity, 2, a cracked tooth, of course pain. But what I'm saying here is that the reason you get the pain is either because of a cavity, a cracked tooth, or trauma, either getting hit in the tooth. Those are all things that can cause a person to need a root canal. And how do we determine if you need a root canal or not? We have a couple tests that we do. We do what's called a cold or hot test. There's something called an electric test. We also look for evidence of pathology on an X-ray to see if the tooth will possibly need a root canal. And of course, pathology on an X-ray doesn't necessarily mean that you may need a root canal. That can go into other issues such as cysts or other pathology. But we have to use these in combination with the tests and use our best judgment to see if tooth needs a root canal. Usually there's a few stages that a tooth goes through in order to need a root canal. But person needing a root canal, if you leave it alone, you don't do the root canal, you're risking extraction of the tooth, formation of an abscess, things like that. So you always want to make sure that if you need a root canal, get it taken care of as soon as possible. There's also risks of doing a root canal. Just because you have a root canal done doesn't mean that it's done, finished, that the tooth is going to be okay for the rest of your life. That root canal can always get reinfected. There's always a chance that an instrument that's used to do the root canal can separate in the tooth. These are all factors that can play into the success of a root canal.
Wow. So basically, let me ask you this. Does a root canal really still hurt? Because, I don't think the chokes are, all over the world. It wouldn't matter. I'm born in Austria. I've worked in 12 countries. I don't think there's any place where root canal pain and something really bad, doesn't get connected. Kind of, well, this is as bad as a root canal. I'm afraid of dating girls the way I'm afraid of root canals. Whatever a person is afraid of, he compares it to a root canal. And I have gotten a couple of them in the last, 10 some years, and frankly, they didn't hurt. Did I like sitting there for an hour? No. But did they hurt? No. So what's this mystery about root canal being such a dreadful procedure?
Well, usually it's one reason why root canal patients don't like is because they have to sit there for about an hour and a half to 2 hours with their mouth open, and they have this rubber thing going over their mouth to isolate the tooth. That's one thing. But in terms of anesthesia, usually I will not do a root canal if a patient can feel it. That is a big no-no. One reason why that does happen is because either the tooth is severely infected, and usually the course you should take in that term is give the patient some antibiotics for a few days, then attempt to do the root canal with proper anesthesia. Patients should not be able to feel anything during a root canal. Most patients will not feel anything after a root canal, although some patients will have some discomfort for a few days, and we prescribe them the proper medication, either be it painkillers or some antibiotics to help the infection resolve quicker. But in terms of pain, during the root canal, you should not have any discomfort during the root canal. You should have sufficient anesthesia. And like I said, if you do have discomfort, then you should be on antibiotics before the root canal is done so that you don't feel anything during the root canal.
I see. All right. And what's the story about needing a crown after the root canal? And some people have had a root canal long time ago, never had a crown, nothing bad happened, and yet every dentist insists to do a crown once there was a root canal performed. Can you talk about that?
Of course. Sometimes, especially on back teeth, what happens is back teeth absorb a lot more chewing forces, and when you do a root canal, you're basically hollowing out a tooth. Okay, and so when you're removing that supporting structure of the tooth, you're making a hole in the tooth, and if you bite into something, there's always a big risk that you can crack that tooth. Now on the front teeth, it's not as important because front teeth, although you bite into things, you don't chew with them, and you can be more conservative in accessing the tooth. So it is not always necessary to crown a front tooth, but on a back tooth, I usually, 95% of the time, or more like 99% of the time, will recommend a crown on the tooth. A patient may have had the tooth root canal 20 years ago, and I've seen this quite often, and nothing happens. Absolutely fine. It just, maybe their chewing habits are different, but you don't want to risk spending all that money on a root canal, and then your tooth cracks, and now you got to remove the tooth. That's one of the risks. I had a patient come to me for a regular exam, front tooth. He had a root canal done many, many years ago, about 15 years ago. We're like, oh, we'll keep an eye on it. You know, you've had it for so long. Week later he comes in and the tooth is cracked to pieces. So that's sometimes one of the risks you're taking without crowning it. Of course, on the front teeth, you don't want to sometimes crown one tooth and leave the other tooth because sometimes they will, you know, it's hard to match. Usually you'll want to do two. So if it's a very small access to do the root canal, then we may not crown it. We'll just put a white filling on the back. But if there's a lot of big cavity, I will usually on the front teeth recommend it. But on the back teeth, 99% of the time, I will recommend a crown.
Well, I can see, like when you explain that, you know, you're basically making a hole almost like a pipe. So your tooth becomes a pipe. That's the way you explain it. And so if it cracks, I mean, number one, the tooth is gone probably at that moment, but it might not crack above the gum. It might, I guess, crack all the way down and leave splinters in it. And I mean, just from a mechanical viewpoint, I can see that that's much more difficult to sometimes. It could be painful to get that thing out then, right?
Yeah, especially with a root canal treated tooth, what happens is you've hollowed out the tooth, the supporting structures are much, much weaker, and usually you'll have to remove the tooth in pieces. If you're lucky, you'll get it out in one piece, but usually you'll have to cut the tooth into pieces and get them out little by little, and that creates more problems in terms of recovery after the extraction. It will take longer to recover. Sometimes we have to remove bone unnecessarily because, you know, the tooth we need to remove the roots. We can't just leave it in there, otherwise it can cause an infection. So unfortunately, that's one of the risks you take if you don't crown the tooth, is not only $900 or $1,000 down the drain because of the root canal, you didn't crown it, but now you got to spend money to remove it. So it's economically a drain for the patient, and post-operatively it could be a drain for the patient because it can take longer to recover from that extraction.
Right. And it probably never happens at a convenient time, just like a flat tire never happens at a convenient time, right?
Oh, of course not.
Of course. Well, all right. Thanks for explaining that to us. And I guess we can visit you on your website for more stuff and on your phone number to call for an appointment in your office. Bye-bye.